Once you have all these articles to review, it's important to appraise the information. What attributes you appraise will depend on the type of data you're appraising. Most guidelines will offer strength and quality of evidence for each recommendation, with the strongest recommendations usually based on the highest quality evidence. But there are some general things to consider, like potential conflicts of interest, the recency of the data. If this is a 60-year-old study, it may not be applicable anymore. If the journal or the place that it's published is peer-reviewed, and whether or not there's a clear hypothesis that's been stated. When you look at the methods, you should look for whether or not the research question is relevant to the question you're asking, if its inclusion and exclusion criteria are consistent with your patient or your practice, what type of study was conducted, randomized controlled trial or cohort study, and what biases may be inherent in that, and whether or not the study design followed all the way through the study. You should also ask if there's potential for bias and if they address this or if they discuss its potential effects on their results. You also want to know if the outcomes were measured and if those are valid for the question that you're asking and if they provide relative information. When you look at the results, you should look to see if the baseline demographics between the two study groups are similar and if they're significant or similar to the patient that you're looking at. You should look to see whether or not the statistical analyses are appropriate for the type of study that was conducted and whether or not those results are presented in an article and what those results are. You should also look to see if they represent the original outcomes that they plan to measure, because sometimes they'll change them halfway through a study because there's a different outcome that looks more promising. When you review the conclusions and discussion, you should really look to see if the data supports those conclusions that the study is making and whether or not the authors discuss limitations of the data or the applicability to certain populations, and whether or not they talk about areas of further study that their study doesn't address. It's important to ask questions when reviewing the literature to determine the validity and generalizability of the evidence to your patient or your patient population.